Hello, my name is Gabriella Ward, and today, throughout this presentation, I will be focusing on the ethical issues around patient autonomy within healthcare. Throughout this presentation, I will cover my purpose statement along with an introduction, the ethical dilemmas and main issues surrounding patient autonomy, several ethical considerations such as the principles, political, legal, and economic issues related to public health practice. Then I will cover the ethical framework along with a policy analysis, and lastly, I will cover a conclusion and future things to think about. To start with an introduction and get a little bit of background information, the major bioethical principles are respect for autonomy, beneficence, non-maleficence, and justice. These principles serve as commanding clinical foundations according to Beauchamp and Childress. In healthcare decisions, respect for the autonomy of the patient refers to the fundamental right of individuals to exercise their freedom and make informed decisions about their healthcare. Patient autonomy essentially grants them the opportunity to actively participate in the decision-making process and have control over various aspects of their care. This includes the ability to choose a treatment path that aligns with their preferences and values. Continuing on, I will now cover the purpose statement. The ethical dilemma concerning patient autonomy is evident in the core principles of individuals' liberty to accept or refuse medical treatment, while emphasizing the intricate balance between respecting patients' rights to make informed decisions about their own health care and ensuring the primary objectives of offering assistance and promoting well-being without inflicting harm or showing disrespect. The main topics of discussion are respect for patient autonomy, informed consent, patient religious standards or doctrines, which is a personal aspect, and deception on behalf of a medical provider or outside force. The first main issue I will cover is going to be informed consent. And when gaining informed consent, it is important for physicians to understand the patient's age, their capacity, legal status, or healthcare directives in place. Healthcare providers should determine and assess capacity of the patient to gain informed consent, whether that's from their parent or guardian, a legal surrogate, or healthcare proxy before proceeding with any medical interventions. Healthcare providers are required to provide patients with necessary information regarding their treatment options. They must inform patient about risks, side effects, and alternative treatment paths. And lastly, ensure the patients have autonomy in the treatment decisions. The next ethical dilemma and main issue that I will cover is the infringement of patient autonomy. In the Medic portal, NINAM extensively examines various facets of patient autonomy, highlighting instances where autonomy of the patients is infringed upon. Several contributing factors to this issue include patients may take into account personal factors, coercion or undue influence, limited decision-making capacity, and legal relationships or guardianships. Examples of this include disrespect, manipulation, pressure, and threats to harm. With that said, healthcare providers cannot force or impose certain treatments on patients and should be able to recognize the presence of these circumstances. Moving on to some study objectives. Patients' healthcare decisions are often influenced by their cultural or religious beliefs, which may conflict with recommended treatments or medical advice. An example of this would be a Jehovah's Witness or JW. And in the case of treating a JW, physicians must honor their religious beliefs and autonomy rights and seek alternative care solutions that do not involve blood products. Public health concerns such as refusing vaccinations during a disease outbreak indeed creates a conflict between individual autonomy and the greater good of public health. There are also several controversies revolving around women's reproductive rights, non-mandatory organ donations, and patients' freedom to leave the hospital at their own wish, even if it goes against their own care. Moving on to the ethical considerations and policies related to public health. The general moral considerations, principle of utility, and distributive justice closely pertain to public health. The principle of utility prioritizes connection between offering benefits and the entitlement to decline care or medical services. Distributive justice and procedural justice require that we treat others justly and equally. For example, the constant challenges of allocating limited resources, such as in triage and organ transplantation, relate to this. When ethical dilemmas arise concerning the overall well-being of the public, an approach that prioritizes the preservation of liberty, privacy, and confidentiality should be strongly advocated. Moving on to ethical considerations related to political, legal, and economic issues. Many health challenges present themselves within the U.S. healthcare delivery structure due to demographics, age range, economic structure, and socioeconomic status for different populations and groups of individuals, all with varying factors that determine their health and the overall population health. Political issues arise when restrictions are made to women's rights regarding their choice for abortion as a constitutional right. This challenge does not stop abortions from happening, unfortunately, and instead it makes them unsafe and difficult to access. If certain legal structures are not in place, infringement and constriction of patient healthcare can be unethically present. To emphasize the economic issues in relation to QALY, the concept of QALY identifies the significance of quality-adjusted life years in relation to public health and the specific variables that can ultimately shape a population health objective. There is a partiality towards promoting quality aspects to healthy individuals without any underlying conditions at their specific stage in life, rather than those in poor health conditions. Health equity in this form is an example of social injustice due to health disparities and limited access for these specific groups. According to Snyder, he discusses how the intervention discriminates against individuals with poor health outcomes and how the public health officials are seeking opportunities to maximize health benefits for a larger portion of the population in order to demonstrate the effectiveness and validity of QALY. However, it is clear that individuals with greater health needs may have a greater benefit from these interventions, but more often than not, the people in these communities face several obstacles such as limited resources due to language barriers, economic constraints for healthcare providers in these areas, and challenges in accessing health services in rural areas. The potential impact on health and wellness. Patient autonomy has a profound impact on health and wellness by promoting engagement in healthcare decisions, enhancing communication and collaboration with healthcare providers, improving treatment, fostering mental and emotional well-being, and improving overall health equity and social justice. Moving on to health policy analysis via an ethical framework. Throughout this ethical framework, I will cover the main ethical issues, common key terms such as patient autonomy, liberal individualism, consent, and healthcare transparency. Then I will cover the facts, alternative actions, and address the situation. Overall, the framework covers individualized health and the rights lens, or liberal individualism, which best represents the respect for patient autonomy. To start with the facts, I will cover which individuals have a greater stake in the outcome. Legal responsibility is a crucial consideration for physicians as they maintain professionalism towards their patients. Ethical dilemmas surrounding the denial of care can both impact the physician and the patient. When faced with a refusal situation, the physician must communicate the potential risks and negative consequences for the patient's health or well-being. Lastly, the physician must assess whether the patient, who may be under 18 years old, mentally incapacitated, or facing an emergency situation, has the necessary understanding and decision-making capacity regarding their health. The importance of these concerns. The decision-making process possesses challenges for both the patient and the physician, which may vary depending on the circumstances in this particular case, and this factor undoubtedly causes a concern for the physician. According to the American Medical Association Code of Medical Ethics, the process of informed consent occurs when communication between a patient and a physician results in the patient's authorization or agreement to undergo a specific medical intervention. When exploring the alternative actions through different ethical lenses, there's the rights lens, the justice lens, the utilitarian lens, and the common good lens. The rights lens prioritizes upholding rights to refuse treatment, right to make decision about healthcare, and respect for the patient's choices. The justice lens prioritizes fairness and equality in healthcare, as well as addressing disparities and inequalities. The utilitarian lens considers consequences of patient's choice along with societal welfare. And lastly, the common good lens prioritizes promotion of health outcomes on both the patient and the community. Implementation of the decision concerning the rights lens. When considering patient autonomy in healthcare, liberal individualism is a crucial factor for both the physician and the patients. From the perspective of the physician, this approach upholds respect for patient rights, facilitates a shared decision-making process, promotes informed consent, acknowledges the influence of cultural or religious beliefs, and provides necessary support. From the patient's perspective, the rights lens empowers them to actively participate in their healthcare, promotes transparency and honesty from the physician, and encourages collaboration in shared decision-making. In conclusion, healthcare providers should continue to follow ethical principles of prioritizing the avoidance, prevention, and elimination of harm when a patient refuses care. Additionally, they should carefully analyze the risks and advantages of each situation. They should refrain from forcing any treatment upon the patient without their consent, as this could potentially harm them. And lastly, assessing and weighing the risks and benefits is essential in such cases. Lastly, here is the list of my references. And I would also like to say thank you for listening to what I had to say on the ethical issues concerning patient autonomy, and I hope you have a great rest of your day.